Go ahead and get started with the meeting today. Apologize for being a few minutes late. We had a little bit of printing that needed to be done at the very end, but we will get started today. And I'd like to open this meeting with a word of prayer, if we could. Our Heavenly Father, we thank you for all that you've blessed us with. We know you've been good to us in so many ways, and we call upon your wisdom and help in all that we do, that we could serve the people of Georgia and we could do it according to your will. And we ask this in your name. Amen. All right. Well, we've, as you know, we've asked for some recommendations for different people. And actually, before I get started, I did see a brand new member of the House of Representatives. Have you been sworn in? Great. If you want to come up, maybe that very first mic. I understand the podium's not working, but introduce yourself to us. Mark Morris, the new representative out of, I believe, Cumming, Georgia. Okay, just this one over here. That one's not working. That very first one. You can pick it up and talk into it.
I've probably never really been accused of needing a mic, but I am Mark Morris. I'm from the 26th District, elected recently in a special election to fill the seat that Representative Duncan vacated when he started his race for lieutenant governor. So I am not the very newest kid on the block, but I am one of them. So I'll ask for your patience and your prayers. So thank you very much.
Well, congratulations on your election, and look forward to working with you. And we also have a new Senate research individual here, Ryan Bowers-Sox. If you want to stand up and make sure everybody sees you. He went to the University of Georgia and graduated from law school at Wake Forest. I'm a graduate of UGA. My daughter that works at CDC went to Wake Forest, so he's on a good start already. You know, he comes by two good schools, and we're looking forward to his help in the session this time. So we've got several different pieces of paper here. We had asked for recommendations from the members, and I know from Mr. Jane we got a pretty detailed talking points, and a couple of other members had sent in some recommendations, and with that I had put together some recommendations, which is not really titled on there, but it's 1 through 6 with 6 on the back page. We've also got the final committee report that our research staff has put together of the actual meetings. So with that, I know that people haven't had the recommendations and need a little time to look at them and discuss them. But as far as the final report that had gone out without the recommendations, those are here today. And I know everyone's had them, and it's been the sole topic of discussion in your house. Just kidding, but if you have any questions about these, concerns, anything that you feel was left out that shouldn't have been, but this is basically just a recap of the presentations that were made of the committee here. With not hearing any, we will, well, wait a minute, on 15 here. Okay, that's going to be Representative Gardner, I believe.
I'm reading kind of fast here. Some of the report was really helpful in summarizing and putting together the whole picture and helping me understand a little bit about what your agenda was.
That closer to you.
You want me to talk to the mic?
Just so the
You wanna hear
people,
my
the wide audience
wonderful
out there can
voice?
hear you.
Thank you very much. I just want to comment on the people who wrote the report. It was very helpful, and it gave me a better perspective on the issues that we're facing, and how important it is, as a member of the Health Appropriations Committee, how important it would be to be able to have some identification of people that had been in corrections, that had been in mental health, that had been in all the various systems. And I couldn't quite read fast enough, but it seems like one of the issues is not to use Social Security numbers, but to use some kind of a state ID, which I understand already exists maybe in DFACS, so that people would I mean, is that part of the recommendation somewhere?
Right, it needs to be de-identified.
Right.
And we've seen other states that have done this and, have set up a process to make it work in that. And as well as it being de-identified, then it actually, and we can talk about this a little bit later, but it makes it more secure because instead of sending out identified data to people who then are responsible to de-identify it and use it, they're only getting the de-identified data.
Right.
And so I think it will make things a lot faster if we do that, as well as a more secure environment for this data that we are charged to protect.
So that helps us get rid of some of the regulations like around HIPAA and the use of Social Security numbers. It's a different number.
Right, and any of you experts in this field that want to comment on this, you're welcome to. Are you 14?
I am 14.
Okay.
I think with the de-identified information, it'd still be wise to treat it as PHI from that perspective because it'll be a longitudinal record.
We're having problems hearing on the phone.
And CMS already established that. They have a Benny number that they'll send out in a research level file, but you still have to treat it in your research as though it's PHI, even though the possibility is less to identify it because it's a longitudinal record and can be tracked. You can identify the person if you really wanted to. So that would be the only caveat.
So that would be for healthcare only?
Well, I think there's certainly sensitive information and corrections in anyone, but I think just keeping sensitive information that has that longitudinal record treated, even though the likelihood is less that you would actually identify the person. It's kind of a standard, at least at the federal level, I know from some of the work I've been involved in.
So are you imagining it a federal system?
No. But it's kind of a standard to maintain that record as if it was PHI to those
So
standards.
anybody who comes in with a slightly different name, like Pat Gardner or Patricia Gardner, would be identified with one single number?
Hopefully. There's
Yeah,
technology
that's-
that allows that in the medical field already. It's called a masturbation index, typically.
And there's other states currently doing this as well,
Right.
statewide.
It just seems like an important piece to get us. And then the other question had to do with who gets to use this data system. Would it come as a request of an individual department?
Well, I think that's a longer-term process, but
Okay.
I do, my personal opinion is that, if we have de-identified data, that we let it be used as broadly as possible by all our departments in their projects and try to eliminate the silos that prevent people from getting to this information.
Well, that certainly is the point. The question is whether if the Department of Community Health decides they want to do a study and mental health says, no, we're not ready, we don't want to participate, will they have the right to veto participation? I guess this is into what the governance would be, and maybe
Right.
maybe
The governance, once any legislation was passed, would be a part of that, certainly, on how that's used. Now, we heard from South Carolina when they were here that, and from Emory, I think Dr. Druss, that he can get information from South Carolina in a couple of weeks that takes many months to get from Georgia.
Right.
And so it's not just for the state, it would be people like Emory that could benefit from this as well if we are able to break down the silos and have a good set of integrated data.
and so the board is established in the Senate bill that you.
It is, and that's something that needs to be discussed. This particular bill really doesn't. It sets up a group that would do this with appointments from the lieutenant governor, from the speaker, and from the governor that would not come out of our bodies, but more out of experts in the field, and then a lot of different department heads. And one of the other goals of this, besides obviously getting a structure in place, is to maybe get these various department heads together a little bit more often and communicate about the common issues that they have. I know, in the past, I believe Representative Dempsey and Senator Underman have had some meetings with department heads, haven't you, to try to bring them together in this respect?
And I noticed in I'm sorry about my voice, but I can't do much about it. In your talking points number 2, you mentioned that it would be the primary owner. The legislature would be the primary owner, but we're putting it in OPB. The board is going to.
Well, there's 2 different sets of talking points. The one
Okay.
that says talking points is actually what was submitted by one of our members, Anu Jane, at the last meeting, I believe, that we had. So since that's part of the recommendations brought forth to the committee, you know, I've tried to incorporate some of that into it.
Okay.
But I do, while I would like the legislature to obviously have access to it, it's kind of hard for the legislature to manage something down here. I mean, it.
I think we shouldn't be managing. Yes.
Right. I think that's one thing we would have to look at is we really are not a managing body down here, so it wouldn't be in our group to do that particular thing. I think the suggestions as a whole, you know, are certainly something that we should look at.
So that's sort of in conflict with the bill, which puts it in OPB.
Yeah, it would turn it over to a group of department heads and appointments by the governor and the speaker and the lieutenant governor
Okay.
to look at it going forward.
Okay.
Any other questions at this particular point? All right. Did we have somebody calling in? I thought I heard her voice earlier.
Yeah, yeah, this
Yes, Patty
Joe
Labley's
Zimmel.
on the phone.
Okay. And anybody else? I heard a guy's voice.
yeah, Joe Dummel.
Oh, okay, great. Okay. Thank you all for calling in. And I should have stated, we do have a quorum here even without the call-in, I believe, but we've got more than a quorum with that. So I would ask the committee their pleasure. I know from my perspective and trying to incorporate some of the different recommendations, I put together a list of recommendations which we could go over. And then the other one is we do have Anu's recommendations, which I tried to sort of blend in there as well into what I did. But maybe I should, and I know you're some of this you're just seeing for the first time, Anu, but if you want to, did you want to speak to either one of these documents at this point? Or give you more time to look at, what's your number? 27. Okay.
No, thank you. Just looking through, I think these are the 6 recommendations right here. I think it encompasses,
the back.
you know, most of what we discussed in the other talking points here. I would just counsel the committee that as it moves forward, just, you know, give a lot of thought to, you know, how this gets contracted going forward, right? So breaking apart really software and services, and really thinking about how we drive to getting quick value. And I think you had hit that in your point number five or 6 here, right? Which is, let's take 2 or 3.
That's point number 4, yeah.
Point number 4. Take a couple of just small wins and go get them quickly. All right. So my point of view is typically do that in a, you know, call it 8 to 12 week segments. We talked about 6-week segments last time around, but really just if we can focus ourselves on getting wins and being as federated as we can, I see that as a win. So yeah, I'm very supportive.
All right. Okay, anyone else with comments on these? Let's see, you're number 20, okay. All right, Chair Dempsey.
You know, I think if anything, from
this time we've learned how difficult this is, how challenging it is, and that there's more work to be done. So as we look at sort of finalizing any kind of statements to move forward in a report, I think that certainly we need to start off, first of all, embracing that, if possible. So when you come down to the bottom of number 5 and 6 on the smaller print list, I mean, I think those are almost our first two in a lot of ways. That's the highlight in my mind, is that it's difficult, that there's more to be done, and that while all of us would like for it to happen quickly, there's danger in the quick. I think that we need to work toward having, whether it is, I'm not as familiar with any other recommendations from study committees going directly to a specific bill number. I think we can take that in a broader conversation, that legislation for sure would hopefully be drafted this next year that could allow for a policy group to develop under the governor, the lieutenant governor, and the speaker's appointment. That would be my thought. I'm throwing some ideas out here, y'all, so don't get, that would be an ongoing work, that we've done what we could, we've brought it to this, we've compiled some information, and now it's time for some others to move forward with it quickly, much like I would say in reference to what has just happened with the governor's Children's Mental Health Commission. A conversation, a lot of information brought forward, but then we need that really policy-oriented group to come together. They're the ones who do have the ability to do it quickly because they also know the funding mechanism, which will be the key to it. I think that, we need to support the opportunities that may exist in Pennsylvania if this grant does come through, and that they should continue to look at that in all other states, still with the focus on a Georgia product. This is Georgia's data integration system, and we need to learn all we can from all the other states possible, but to make sure that it is Georgia's. And on news work, I want you to know, I think there are a couple of things that I highlighted real quick, just that it's language that I think we need to see about integrating into whatever we can here, which is about the cross-agency, cross-program centralized data repository. I think that's real important. I think that's real important to get in the recommendations, actually. And then also the procurement of a legislative enterprise data warehouse, with a big question mark as to who and how that is, done through the appointees of those in the executive branch.
I'm 28 if you need.
All right.
I can speak up if I have to. Do we have anywhere that actually lists the applications within the departments that would want to be folded into this? I mean, it looks a little nebulous, just kind of adding all of this, it says we're going to have this data repository, we're going to have all these things, but we really need to work through to see what we're actually going to put into this, rather than just say we're going to start throwing things in. Is there even a list of what we're going to start with?
Well, that was really going to be the next step, which was this governing board,
Right.
which our Senate bill did address setting up a governing board, which really wasn't legislatures. These were experts appointed,
Right.
and department heads or their designee
Right.
of the department head that were going to do this. So, I can think of about 20 silos
Yeah,
out
and
there,
that's-
but we were trying not to just identify them.
Well, I mean, just
Specifically.
trying to get the grasp around how much data is actually going to be pulled into this system. I mean, this could be a significant amount, and while, de-identifying is easy when it goes system by system, once we start adding this many together, especially with the disparate systems and probably homegrown applications for a lot of the agencies, it's going to grow very, very quickly. And while the governance board is there, I think there needs to be some investigation beforehand to kind of get the beginning scope of what this is going to be. I think a recommendation should definitely be more investigation as to the areas that we want to start with, or the governance board needs to start with, because saying that we want to throw data into one place is great, but without the scope to begin with, it's going to be very, very hard to even get RFPs together to do the data warehousing.
And I think we're a ways from RFPs, and
Right, but still.
I know you're used to business moving a little bit quicker
Well,
than
don't forget
government.
I'm the one that helped
But
reform
I
the
guess I
system
was
here.
looking too with the University of Pennsylvania, since they've gone through this process with
Right.
other states, that they would also be helpful in saying,
I'm sure.
you know, I'm certainly not the expert in this. We brought some experts like you in, but the University of Pennsylvania has worked with 16 states, and they're working with 10 right now. So besides this governance board, which had our own Georgia experts, we also were going to have them help us. How do we get started in this process to do it? So I do understand what you're saying. I just don't think I'm the guy that can tell you
Well,
everything that
think it
goes in
needs to
there
be-
right now.
I think there needs to be a recommendation that leads to that.
Yeah, what number are you? 24, okay.
I apologize for being late. This grant from Andy Casey Foundation,
Mhm.
to utilize this grant, do we have to set up what you're trying to do here with the legislation?
They only asked that when we applied for the grant, that they saw that there was a serious effort by the state. They're like, if you guys aren't serious,
That's
don't
my
waste
question.
our time. But they didn't give us anything of you have to have this law in place, or that they wanted, and that's one of the reasons that we had the letters of support from Speaker Burns and from the Lieutenant Governor, to show them that we are serious about going forward in this process.
I guess what I'm asking you, though, to show them that we're serious, we've got to have somebody that's going to be dedicated to doing this project. I'm trying to justify the legislation, okay, is what I'm trying to tell you.
Mhm.
And I understand what Katie said, but, excuse me, Co-Chairman Dempsey. But it seems to me that if you're serious about this, you've got set something up to be a working group to move forward. And so whether the legislation is perfected in the way it's written at this point, we have to have something like this, particularly with expertise involved, versus legislators. And I think that's what you're trying to do with your legislation.
Right.
So, and again, I'm not saying, because I just saw it, word for word, that the legislation is what everybody wants, line by line, but the idea is, you've got to have something that consists of a working group with professionals that know what they're doing versus us 6 meeting experts, okay, to move forward. And so we're gonna have to do something like this with the legislation you all have drafted. I think I understand, is that correct?
Right, we've got to have some process to make this go
And,
forward.
and
yeah.
for us to have another legislative group continue to do this, doesn't cut it. So, this kind of legislation, we're gonna have to do one way or the other. Now, we can perfect it the best we can, but that's where we're going, right? I mean, from your perspective.
From my perspective, that's.
I mean,
that's
there's
what
really
we've
no other
gotta
option,
do.
is there? If we wanna, and then to define the scope, I mean, we sat there in those meetings and, you know, you can keep adding people as you go along, but community health and the other, the ones that you've added here from the beginning, the ones that you've got on the commission, those were the big dogs, for lack of a better word, right? Where we get the biggest bang for the buck, the way I understand. I've even got Pat nodding it, so I must be saying something right.
Yeah.
So, anyway, okay, I just wanna make sure I was on the right page with you.
Okay, and then I think next was Calvin, if you want to.
Yes, Mr. Chairman. Just echoing a couple comments. I think to be successful, we really should look at narrowing the scope, and but having a long-term vision as to where we're trying to go to. And I think your comments around, you know, focusing on some key healthcare agencies, because when we look at the whole state, and it's 11 or 1,200 systems that we have running across over 100 agencies, boards, and commissions. So knowing what we're trying to accomplish in the short term, medium term, I think helps set some very targeted areas. And you know, the gentleman that was in speaking to us from the University of Pennsylvania, seems like if we look at where did they start, of the data that they're pulling together from agencies, where do they see the most value? And then, because we don't have to start from ground zero, we could try to leverage what they have already seen successful, which seems like would be a pretty good place to start and be able to show some success much earlier, you know, in the process. So that's a couple things. So I guess some of the, wrote down a few words here that might help shape some of that. There needs to be a framework created to leverage the vast amounts of data spread across numerous state agencies in order to make more informed policy-based decisions using de-identified data, and probably adding on to that with the very initial targeted view with the healthcare agencies. And even if this group had even something within healthcare agencies, it would be a good place to target and begin with. That would even be helpful as well.
Okay, and is Kate still here? Yes, sir. There you are. Oh, you're hiding over there. Were you able to get all that? Okay. Okay. And Senator Unterman.
Thank you, Mr. Chairman, and Chairman Dempsey. I appreciate y'all's work on this. And, you know, I know this study committee has been in the works this year, and I believe in the Senate we've been working on this issue for about 3 years now. And my main concern is to continue studying an issue as these departments become more and more entrenched. And the reason I say that is because the biggest project that I've been involved in has been the DFACS Gateway project that I think was $25 million or something like that. And the more we delay and the more you don't have oversight and kind of an umbrella, these silos become more and more entrenched. Because just like DHS started this DFACS program, well, it would be very difficult to get them to give that up now. And as we continue to wait, all these departments come forth with their own warehousing projects. So it kind of defeats the purpose. The more you delay, the more they become enveloped in their own silo. And yeah, they are sharing data, but they own the data. And the question is a bigger umbrella, in my opinion, so that it's not them driving the train. It's the legislators and the people that appropriate the money that get the bang for the buck, I guess it is. So I think, and I don't disagree without putting specifics in here about the different systems that are already set up, but I don't have a problem, and I understand what Chairman Dempsey's talking about with putting a reference to a specific bill in here, but I think if we don't push the lever and continue pushing, you know, we'll be here next year talking about the same thing. And, you know, that train's leaving. A lot of people, when you start talking about departments spending $25 million on one project, and here we are in the midst of an opioid crisis, oh my gosh, it's like it's trying to slap us in the face and saying, here we are, help us do something. And like you were talking about a targeted population and a targeted project, I mean, if this were the private sector, the horse would have been out the barn 3 years ago when they started thinking about it, or else you'd be out of business, right? So government can only be slow for so long, and I think the recommendations are good, and I think we need to move on.
I will say on the gateway that I think that was just the state dollars. I believe that there was 90% Fed match to that, so you've got to multiply those dollars a lot more that were spent on that.
And here we are with the opportunity to work with a system that's already working with the University of Pennsylvania, and I've been very impressed with them. And of course, Annie Casey, you know, the state of Georgia they've been an integral part of our business for years and years and years. And I think it's just, you know, it's all laid out before us, and I just appreciate the committee delving into it.
All right, Representative Gardner's waiting, but I don't know if you wanted to.
Just to underscore what Senator Miller was saying, we need to make people believe that this is going to be truly independent and not dependent on any political party or any governor or any lieutenant governor. It needs to just reek of independence. I think it was what's going to make it work. The second question has to do with the work that Gateway's done, which is identifying and cleaning up roles of people that we know are duplicated, and I think they've made a lot of progress. But wouldn't this structure be able to use what Gateway has done? Okay, all right. I thought I thought we were creating a separate
I
system.
I hope so, but
Me
I don't
too.
know. I would
But
think
that's
so.
important,
Yeah.
yeah.
Okay, Representative Dempsey.
Yeah, in my mind, Representative Gardner, it would be that we could build out from Gateway in that in that part of the budget and that part of the need, but do it in a much more cost-effective, probably improved way to build on that, not to start over at point zero. But no, as far as the recommendations, all I'm saying is that we need legislation to do that. I'm not sure that it's a certain bill or not at this point, but that would be my recommendation, is that we do have legislation to move it forward and not limit it in any way by an existing bill that hadn't gone through committee yet, because that's kind of a wide open. Let's not limit what it could be.
So do we need
on
to
that.
change that 3 to the committee recommends looking to legislation to determine the system's
We
governance?
recommend legislation. We recommend that there be legislation in this next session. I mean, we could
Mm-hmm.
define it that way, put those terms in there,
Okay,
but
so
not make it House or Senate necessarily.
I understand.
So that it can move. I
Yeah.
mean, that's all I'm saying is let's find the best way to get
Mm-hmm.
something that moves forward on it. And I don't know exactly how we come up with those experts that we're speaking to, other than that we try to lean on those executive appointments. I mean, I don't think the legislature could do it, but I think that the three heads of the three could come
right,
up
and,
with.
and we had
And that could be in that legislation,
in,
basically.
in this particular legislation, it
Yeah,
has that, but
that's a
it could be in
great
any
suggestion.
legislation. You're correct.
Patrick, I had one question because you kind of faded out at the end of what you were saying. I was trying to grab onto it. What were you saying at the end?
My comments are basically just, we have a huge scope ahead of us. And
Hang-
not only can this create a great data sharing within this type of information, but Georgia really needs a data warehousing policy to begin with. Like a full policy that is sent to agencies that basically says, if you're going to warehouse data, this is how we need you to do it. This is how we'd like you to do it. And this is what you will follow. In order to get RFPs pushed out, in order to get any of those things, this is what you must follow from now on. So there is interactivity, even if they might not be participating in this right away. At least we have a future state that is available when we do decide to bring in these other pieces.
Right, and my thought was this group of experts and department heads from
Helps
the state
create that.
helps create it with the University of Pennsylvania,
Yep.
guiding them on what worked in other states and didn't work.
Yeah, because I think that would be helpful to GTA, especially when you're doing all your work, having a singular data warehousing policy for all agencies involved, so that if something does happen, GTA can jump in and take care of it in times of crisis or whatever is needed.
Okay, so Representative Harrell's been waiting a little while here. Let me get his comments.
And I guess my comments are I think it's up to Representative Gardner and Representative Dempsey and myself to make sure whatever moves in the House is reflective of what this committee has done. It appears that the Senate bill, has got some of the outline that we probably all agree on contained in there. It's currently in appropriations, and whether that's the right place or not to go forward with their hearings, but they could always move. But it seems like the testimony we heard today, whether we narrow the scope, which I think is probably to those healthcare agencies, is probably a good starting point. Whether we try to find those 8 to 12 week wins is probably a very wise decision, and to establish a data policy, to your point, even for those that aren't early participants. So as they continue to do their work, they're doing work that is consistent with a future adoption of their agency into the program. Makes a great deal of sense to me. And I guess I say that to say that I don't have any issue with using this framework that's dropped as 184, making those modifications. It'll be modified further, regardless of what the Senate may or may not do once they send it across the hall to us. We'll get a bite at the apple as well. But it seems to me, and I've been down here a few years where I've seen parallel bills introduced in both chambers, or one come from one or the other. And, you know, I'm working on a parallel issue right now, and quite frankly, sometimes it's confusing. You know, when you start off in both chambers, because who's going to get it out? Why don't we just, you know, run the ball from one direction, knowing that we're all on this committee working in for the same ultimate goal, and then that way we can focus our attention on getting that single piece of legislation as perfected as we possibly can, which means we know it won't be perfect. But at least, so I think what we've come up with, and I'm not an expert with the University of Pennsylvania compared to some of the others. South Carolina presented some really, you know, super information as well as did others. And I think as long as if we're going to go forward with that grant request and rely on them, so far as that doesn't restrict our ability in any way to, you know, get best practices from the others that we heard from and others that we may not have heard from. You know, that we don't want to, we want it to be a Georgia program, then I think that serves us, you know, serves our goals well also. So, you know, I'm encouraged from what we saw. I think the comments today, narrowing the scope, build on that defects gateway program, you know, establish a data policy, look for those, you know, 12, 18-week wins. I mean, those are great, great responses and outcome. And if we can do that and get those health agencies to deliver some type of participation in that shorter period of time, then to Senator Unman's point, it'll weaken some of the resistance for those other silos that aren't participating yet. If they can see a victory somewhere else, then maybe it'll help them want to get on board. Thank you.
Okay, well then, and I do appreciate your comments on that. Going back to an earlier point, the recommendation, I think I heard, and maybe Kate got it, was that we talked about making a statement about having a central data warehouse. Do you have that one as it was presented, written down anywhere?
As it was presented, probably not. That'd be fantastic.
So we're saying we need a point in that, and then we can either go through a news points or this recommendation 1 through 6 and talk about them. So what if we take the 1 through 6 and let's just look at point 1, you know, and I'll read it because I know there's people out there that don't have a copy of this as well. Pursuant to Senate Resolution 130, this committee was charged with studying the implementation of a statewide centralized integrated data system capable of being presented for analysis in a de-identified and HIPAA-compliant form. The committee recommends that such system be stored in a manner that protects the data in the same responsible and secure manner that the state of Georgia is currently required to maintain. The data would be available for proper use by the state of Georgia in a more efficient, timely, and effective manner by its deemed users. Further, the importance of the data being identified is a matter of efficiency and security. The committee recommends that each entity that receives the data would not be responsible for de-identifying it. The committee believes this will save a significant amount of time and would allow the data to be used in future projects rather than being destroyed after each individual project. And of course, Georgia State was the one that mentioned getting data, de-identifying it, and again, I think that's some of the time lag that Emory talked about of 2 weeks from South Carolina versus months from us in the process. Is there any questions, concerns? I mean, I think that's a fairly broad statement, but I mean, if everybody's good with that, you know, that second one is just saying that we recommend the laws, funding and structure be established to begin the implementation of the system. Now, the third one, it sounds like, you know, there's people that would rather not have a specific bill mentioned, and I can be okay with that if we just want to say the committee recommends looking to legislation this session that would determine the system's governance and where it should be housed, and take any reference out to that. And it does say that a governing board would have appointments from the Senate, the House, the governor, and who serve as state agency department heads.
I think that would make it a little easier to move on, and that it may well be that piece of legislation. I'm not in any move to change it or say it has to be a House bill or anything. That's not the intent. It's just that as we go into this session, if something gets stopped for any reason, let's make sure we have the option to move forward with legislation somehow.
Okay, Senator Unterman?
I was just going to say that I think on that number 2, we could add in additional language that you talked about creating the system, the oversight of what the parameters were, what the goals are, the mechanism of entry into the system. I think that could be number 2. But on number 3, I agree with you. Just change the language to say legislation. But you have to remember, we can use that as a vehicle and completely substitute the resolution and the bill so that it doesn't get bogged down. We all know we're going to have a short session. So why not use that as a vehicle and just do a substitute bill and get it going?
That option.
Yeah.
And again, this was filed before this group even met.
Yeah, that's what
I've
I'm
learned
saying.
some things, so I don't think
Right.
I would vote for it in its exact present form right now. It's
Right.
just a vehicle
Yeah.
to make something happen, yeah.
Yeah.
Yeah, I think it's important that we all know that. You know, I mean, we're aware of that. I think the committee, the
Yeah.
legislators are very aware of that it may be that, it may be that number, it may be
Yeah.
exactly it is or change. But I just want to leave the door open that nothing stops if we have an opportunity to move forward
Yeah.
somehow.
Okay, well, we'll make sure that, Kate, if you would take our reference out to that and change it to legislation.
Yes, sir.
On the,
The only other thing in number 3 that I would say is that in the second paragraph, when it talks working intimately with the University of Pennsylvania, we might want to take out some of the flowery words in there and just say that we work with them.
is this
It
one
may
of
be
those
the
sexual
University of
harassment things or what here?
I wasn't going to bring it up.
I'm trying to
but, you
avoid
know. No, but I just think that we stick to working with them, and there's another one in 4, I think, that says that members quickly identify. Let's just identify. Let's just take some of that out and make it as good to go.
And the only reason I had quickly was there were a couple of people that said we need to quickly get a couple of wins and show this, and so that was the reason for that. But I'm fine with taking quickly out as well. And we won't be intimate with the University of Pennsylvania or Annie E. Casey, particularly with Annie E. Casey. Representative Gardner.
And number 4, it seems to me that we want to make the board or the committee, the members of this appointed body are going to be the ones to decide which project goes forward. But shouldn't it come from the departments? Shouldn't they say, we want? Or
Yeah,
they need to have input into it.
They need to have input into this, and those appointed members, which if legislation similar to Senate Bill 184 were to pass, has key department heads on that. They're in that group.
Yeah. So we've already.
But I agree, they need to be part of this.
Yeah, they need to
We
be
need,
ready
they
to
need to
do
be
it.
more of it, we need to be a little bit less of it. I agree. Are you wanting to change something on that, or?
I didn't come up with any wording, but based on recommendations or applications from departments. I mean,
Okay.
somehow.
But, so maybe on that first sentence, add that to it, to identify evidence-based solution based on recommendations from department heads. You want to put that in there?
It's not going to work if they don't want to do it.
Right, they've got to have, part of it. Okay, number 5, I guess, is more just a statement of, we realize this is gonna take time, but we also realize that we're way behind some other states, and we've got to be moving in an expedient manner.
It might move up in the chain there, like maybe under, I don't know, number 2 or so. It is a good broad base that we're recognizing it.
Yeah, it was more of a closing statement in my mind, but it can be moved around. I'm fine with that.
Wherever y'all think. It's good language, real good language. And to that, I know that both of our policy analysts worked really hard on this, so thank you.
Yeah, that's Annie. I see she's playing some music for us.
She didn't like that talk y'all just had about sexual harassment, I'm just telling.
Okay, number 6 is again sort of a broad statement that we continue the process. So, do we need to wait on your incorporation, or can we, I know sometimes we vote to do the recommended changes.
Yes, sir. I think we're waiting on wording from you, sir. If we can get specific language, that would be fantastic. And where you would want that, Chairman, in the order of the recommendations, where you would like that to be placed. I
Okay.
think it's something that we're still waiting on.
Can't
What-
we vote subject?
Yeah, why don't you?
By approval by the two co-chairs? We do that.
Oh, yeah, I mean, it's fine with me if we don't vote, as long as
not
we're
for
just
the
clear that there's
NPR.
no opposition to what we've talked about today, as long as everybody is
I guess I would,
good.
Why don't we leave the subject, we vote approval, subject to approval by the two co-chairs with it.
But I think it has to be turned in.
I think we do have to have a vote though, don't we?
Yeah, we've got
Let me
to
check
turn
with the
this
lawyer
in
down
and-
there.
I would recommend that we take like a 5-minute break and allow Kate to get the language from,
Okay.
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 that's totally fine.
Well, you got a deadline.
I've never been on one where we voted.
Oh, really?
No.
I've never been on one where we didn't vote.
Brent.
go ahead and call this meeting back to order. In the interest of time, these are being printed right now, and we'll have them before we vote on them. But in the interest of time, if it's okay, I can start reading off of the laptop these bullet points. Seems like I've got agreement on that. Or maybe we could swap out reading them or something, you know, like a church, they take turns. Pursuant to Senate Resolution 130, this committee was charged with studying the implementation of a statewide centralized integrated data system, IDS, capable of being presented for analysis in the De-Identified and Health Insurance Portability and Accountability Act of 1996, that's the HIPAA Act, compliant form. The committee recommends that such system be stored in a manner that protects the data in the same responsible and secure manner that the state of Georgia is currently required to maintain. This data would be available for proper use by the state of Georgia in a more efficient, timely, and effective manner by its deemed users. Further, the importance of the data being de-identified is a matter of efficiency and security. The committee recommends that each entity that receives the data would not be responsible for de-identifying it. The committee believes that this will save a significant amount of time and would allow the data to be used in future projects rather than being destroyed after each individual project. So that one's pretty much there. Bullet point 2, which is a little bit of new language. Well, it's really not new, it's just been moved. But anyway, the committee recognizes that this is a long-term process of implementation, but is cognizant of its urgency in that the responsible use of tax dollars in improving the health, economics, and well-being of Georgians is dependent upon proven, evidence-based decisions made by those responsible to the citizens of the state of Georgia. Bullet point number 3, the committee recommends that the necessary laws, funding, and structure be established to begin the implementation of the system. In doing so, a framework should be created to leverage data spread across numerous state systems to support more informed policy-based decisions. GTA's board would be directed to adopt enterprise data warehouse policies, guidelines, and standards to allow for future compliance and integration with any data sharing initiatives in the future. Okay. Let me move that out of the way. Okay, you're on now.
My question would be, I thought we had put it under OPB in the other part. So is there any inconsistency there? GTA's doing the policies, but it's going to be headquartered under OPB.
The GTA policies are statewide for all agencies, not just for this single piece that we're working on, but for all pieces in general. Anytime there's data warehousing happening, it should follow a GTA standard that is completely separate from what we're talking about.
So you're saying this doesn't really address where the warehouse is or anything? It's
Where
just
it's located.
it's just a policy.
It's how it happens.
Okay.
So would the governor's office not? GTA is you know, I'm familiar with what GTA is. I'm just saying, wouldn't it be better to be in the executive branch?
No, because they gotta make all the policies, they gotta make all the policies with respect to technology. The OPB doesn't have the expertise.
No, I know, but I'm saying the executive branch.
Well, that is the executive branch of OPB.
No, wait. GTA, who governs GTA?
Governor appoints
Who, you're appointed by the governor.
Governor appoints them.
Right,
Sort of like the Board of Regents.
right. So when the governor's commissioners meet, you aren't included in that, though?
Yes.
You are? So when their commissioners meet, like once a month, you go?
Depends on what the meeting is. If it's the healthcare agency meeting.
No, I'm talking about his, regular monthly meeting.
So, yes, I go to the agency head meetings,
Okay.
together, so.
I just wanted to make sure there wasn't any
And I think
inconsistency.
here we're specifically saying,
If you could pull your mic over just in case there's
I'm
anybody
sorry.
online.
I think here what we were specifically saying is all data warehousing efforts to make sure whatever we do with this project, that they align and the different warehousing efforts can share data.
But
So
does that mean all RFPs who would the RFPs go through?
it would not be the RFP process. It's
This is just the policy.
right, because right now in any
Standardization.
new IT project purchase, agencies are required to follow
Right,
those
the
policies.
RFP.
And so this
Okay.
is just where we do not have a very specific guidance on what how you would put your data into a data warehouse.
Yeah,
This would now try to give agencies some direction.
yeah,
So again, to make it easier to share data in the future.
right, right. Okay.
All right. Bullet point number 4 has been shortened, I think, considerably. It says the committee recommends that there be legislation in 2018 reflecting the recommendations of this committee. Such legislation shall determine the system's governance, and an IDS governing board consisting of committee members appointed by the Senate, House, and Governor, and who serve as state agency department heads. The committee proposes that the department be responsible for the system and that the system be headquartered in the Governor's Office of Planning and Budget. However, the committee recognizes that this has been implemented in other various forms by different states and thus could change depending on future decisions. So we're saying, I mean, there's actually some states that have a university house this. So I mean, there's things out there, but we're saying based on what we know now, this is our recommendation.
Hey, Chuck,
Mm-hmm.
which department? When we say the department, what are we talking about?
Which line are you on there?
Committee proposed that the department be responsible for the system. Which department? What are we talking about?
The committee, that the department, yeah, they would probably, should we say again that the,
The particular department, the particular agency department be responsible for the system?
well,
I don't know what you mean there. The system you got the system's headquartered in OPB.
mm-hmm.
I'm trying to understand the sentence, I'm sorry.
Right, and that's a good point.
Just make it say, the committee proposes that the responsibility for the system and the system to be headquartered in the governor's office.
So take out department in B and just go to there. That's a good point. Friend's picky like that too. If y'all he catches all kinds of stuff over there in the Senate.
Got a liberal arts education.
Yeah, I'm a scientist. I don't do well on that.
So what are we taking out? The committee
Department B,
proposes
just those two words.
that B?
Pros that the wait a minute. Let's look at that again. So what are we taking out? The committee proposes. Say that again.
The committee proposes that the responsibility for the system,
Responsibility. That's what I didn't change. For the system.
and take out that.
And
And the system. Okay. Another liberal arts major over there. Just kidding. Okay. Yeah. All right. Okay, if everyone's good with that, we'll move on to bullet point 5. The committee recommends that appointed members in consultation with state agency department heads identify 1 or 2 policy concerns that can be studied in an integrated form to identify evidence-based solutions. For example, data related to the opioid epidemic, and that should be addiction, not addition. And I'm not a liberal arts major. Are shared amongst various state agencies such as Georgia Department of Corrections, Department of Public Health, Department of Behavioral Health and Developmental Disabilities, Department of Labor, and Department of Community Health. And then bullet point 6, the committee recommends that Georgia continue the process already been begun through the state with respect to data analytics, and that such continuation be done in a coordinated and effective manner.
pretty.
All right.
It's
always nice for legislatures, if you can get it on one page, we might read it. You know, is that what we're saying? Okay, so we need to have a motion, I believe, to approve this.
I'll make that motion
And
as written
okay,
and changed.
And we've got a motion, I think, second by Senator Sims here. So we've got a motion and a second. All in favor, say aye.
Aye.
Any opposed? All right, motion carries unanimously. Again, thanks for helping us struggle through this, and we hope that we'll continue this process in the next session with these recommendations. And I also think that we'll have some legislatures on both sides that maybe understand this a little bit now, too.
Friends.
All right, thank you all. Meeting's adjourned.